Hi, I'm Dr. GVK Chaitanya Rao, your sinus doctor. Today I'm going to talk about a very common nose problem, deviated nasal septum or DNS. I'll be talking about the anatomy of septum in brief. What are the common causes for the deviated nasal septum? Symptoms patients with deviated nasal septum have, how do we diagnose it, and what are the treatment options available for it? I'll be also answering the 10 most frequently asked questions about the deviated nasal septum. So let us now talk about the anatomy of the nasal septum. The nasal septum is a partition which is present dead in the center, separating the right nose from the left nose. This septum consists of cartilage in the front and bone in the back and the floor. When there is a deviation in the septum, it is called deviated nasal septum or DNS. The deviation can be present in the front part of the nose, that is in the cartilaginous part of the nose, or in the back part of the nose, that is in the bony part of the nose, or more commonly at the junction between the bone and the cartilage, that is in the floor of the nose, or in the middle of the nose at where the cartilage and the bone meet. The bend can take the shape of alphabet C or alphabet S, either straight or reverse. So what are the most common causes for the DNS or deviated nasal septum? Most of the people who have deviated nasal septum are born with it. There is a theory called birth molding theory which explains this. When the baby is in the mother's womb, the baby is in a universally flexed state. The nose of the baby presses against the walls of the uterus of the mother or against its own arms and legs, and this pressure can lead to a deviated nasal septum. When the baby is delivered from the mother's womb by natural delivery, the baby is usually delivered in right occiput anterior or left occiput anterior positions. In these positions, the nose of the baby is pressed against the hip bone of the mother. Also, sometimes certain instrumentation is used to pull the baby's head from the mother's uterus. These maneuvers can cause pressure on the nose and produce deviated nasal septum. Also, trauma is one of the most common causes for the deviated nasal septum. When there is an injury to the nose from contact sports such as boxing, or if you are in a road traffic accident and there is an injury to nose, your nose bones can fracture, and this can also lead to a deviated nasal septum. When you grow, your face also grows. If there is a mismatch between the growth of the palate and the nose, this can also lead to a deviated nasal septum. So what are the common symptoms patients with deviated nasal septum experience? The most common symptom is nose block. Because the deviated nasal septum occupies the nasal passageway, the patient cannot breathe well. These patients complain of alternating nose block. That is, when their right nose functions, the left nose is blocked, and when the left nose functions, the right nose is blocked. These patients also develop a tendency to sleep on their right side or their left side, because in that position, the nose stays open and they can breathe better. Patients with deviated nasal septum have noisy breathing. They have whistling sounds coming from their nose when they breathe a little forcefully or during sleep, and their friends and family keep telling them about this. Patients with deviated nasal septum can have nose bleed. See, the air when we breathe through the nose should smoothly flow over the septum. When there is a bend in the nasal septum, this can lead to the air hitting the deviated part of the septum. This leads to dryness in that area, crusting, and when the crust falls off, there can be nose bleeding. Patients with deviated nasal septum can experience single-sided facial pain or headache. This is a little bit of a controversial topic. This is said to be happening because the bad part of the deviated part of the septum, when it presses against the natural swellings in the nose, that is the turbinates, it can cause this kind of a headache. If the deviated part of the nasal septum blocks the sinus drainage pathways, it can lead to sinusitis, and the patient can start having sinusitis symptoms. Similarly, when we breathe through the nose, the air has to reach the back part of the nose, and there are two tubes called eustachian tubes through which the ears get ventilated. Because of the deviated nasal septum, if this ventilation is affected, there can be fluid formation in the eardrum area and also sometimes holes in the eardrum. So when a patient comes to us having any complaints of the deviated nasal septum, we examine his nose under the headlight. Any deviations present in the front part of the nose can easily be identified with the headlight. But you have to remember, the nose is a very deep structure extending from the front of the face all the way to the back, just above the throat. So we prefer to do a diagnostic nasal endoscopy, where we send an endoscope from the front of the nose to the back to identify any further deviations. Also, if we are suspecting any sinusitis symptoms in the patient, we may advise CTPNS, that is CT scan of the nose and sinus. At our sinus doctor center, we specially do a test called rhinomanometry, where you try to identify the extent of the nose block. This test we specifically do in patients who have already undergone septoplasty or sinus surgery but are still experiencing nose block. So how do we treat a patient having deviated nasal septum? See, deviated nasal septum is a very common problem. If the patient is having mild symptoms which is not very troubling for him, we would advise simple medications like nasal sprays, nasal washes and antihistamines. But if the patient is having very troubling symptoms, he is having difficulty to sleep, he is having difficulty to perform his regular activities normally, then we would advise a surgery called septoplasty. This septoplasty takes anywhere between 1 to 2 hours. It is usually done under general anesthesia and sometimes under local anesthesia. In this surgery, we remove the deviated part of the nasal septum. So now let me address 10 frequently asked questions about the deviated nasal septum. My father has it, my brother has deviated nasal septum, now I am diagnosed with it. Will my child also be getting it? No. There are no studies indicating that the deviated nasal septum can be genetically transmitted. So, no, your child will not get it from you. Can the deviated nasal septum heal without surgery? No. The structural issues like deviated nasal septum cannot correct without surgery. However, if you have mild symptoms, we can use simple medications to help you with them. Does deviated nasal septum worsen with age? See, the nasal septum grows up to 15 years of age. So if a child is diagnosed with a deviated nasal septum, the deviated nasal septum can worsen until the nasal septum growth completes. The deviated nasal septum cannot grow with age in the adults. However, the symptoms they experience can worsen if the deviated nasal septum starts causing sinus issues. Can deviated nasal septum grow back? No. After a well-done septoplasty, the deviated nasal septum cannot occur. Can deviated septum grow at night? No, it cannot. See, the deviated nasal septum is a constant issue you will be having. But the symptoms you experience can worsen in the night. Like I told you before, patients having deviated nasal septum prefer to sleep on their right side or left side because they feel comfortable and they're able to breathe better in those positions. Can I live with a deviated nasal septum? Yes, you can. It is not a life-threatening condition, but why should you? If the deviated nasal septum is causing very troubling symptoms, a simple surgery can help you with getting rid of these issues. Is the DNS surgery painful? No, it is not. There can be mild discomfort around the nose, around the teeth area after the surgery, but we prescribe certain medications which can help you with it. During DNS surgery, will there be any cuts or marks made on the outside of the face? No. The entire surgery is done endoscopically, so there will be no cuts, no marks visible on the outside of the face. The shape of your nose will not change with the surgery. Can I breathe better after the deviated septum surgery? Yes, you will see a marked difference in your breathing after the surgery. It takes anywhere between 30 to 45 days for the complete healing complete. So few patients ask, so how can I identify if I have a deviated nasal septum on my own? I do a simple maneuver and explain them. See, with their index finger, they can close their right nose and breathe through the left nose and breathe out through the left nose. Now, they can close their left nose and breathe in and breathe out through the left nose. If they are having difficulty breathing through one side, that means they most likely have a deviated nasal septum. On the side where they have difficulty breathing through, they can simply pull the nose outside by pulling on the cheek. And if they're able to breathe better, the deviated nasal septum diagnosis is confirmed. So thank you so much for your patient listening. If you have any doubts about the deviated nasal septum or any other nose and sinus issue, please write in the comment section below and I'll definitely reply you back. If you have any ideas, critique or comments, also please mention in the comment section below. Thank you so much for your patient listening once again. Bye for now and see you soon in the next video.